Hey, you ever notice your dog or cat's belly looking a little, puffy?
Or maybe your vet mentioned something about their liver during a checkup.
You're definitely in the right place. Today on the deep dive, we're going to tackle a topic that sounds kind of technical, hepatomegaly,
Yeah, hepatomegaly.
but really it just boils down to understanding why a pet's liver might be larger than it maybe should be.
Yeah, and it's surprisingly common to pick this up. Often, just during a physical exam when the vet feels the abdomen.
Right.
Or it might pop up on an x-ray or ultrasound that was done for, well, maybe something else entirely.
Okay.
Just to give you a sense of scale. In an adult dog, a normal liver is roughly 3.5 to 5% of their total body weight.
Huh.
It's actually a little bigger proportionally in puppies and kittens, maybe 4.5 to 5%.
Okay, so when we say hepatomegaly, we're not talking about a specific disease itself, are we?
No, not at all.
Hmm.
It's much more like a flag, a sign that something else is going on under the hood, so to speak.
Gotcha. So our goal today is to really dig into what those somethings could potentially be based on the info we've looked at.
Exactly. Think of the enlarged liver as a symptom,
Mhm.
not the actual diagnosis.
Right.
So we're going to explore the main ways the liver can get bigger, the different patterns of this enlargement,
Okay.
what you might actually see at home if your pet's liver is enlarged, and then, we'll touch on the really wide range of potential underlying causes.
But we'll keep it clear, right? Not too much jargon.
We'll try our best. Keep it straightforward.
Okay, sounds good. So let's start right at the beginning. What actually makes the liver decide to increase its size?
Well, what's really interesting is that the liver's size isn't fixed. It's not static at all.
Oh.
It's constantly responding to signals, especially signals coming from the digestive organs. The pancreas actually plays a pretty dominant role here. It sends these signals, these hepatotrophic factors, through the portal blood supply that goes right to the liver. Think of it like a continuous conversation happening between these organs.
Okay. A conversation that helps regulate the liver's size.
Precisely. It helps keep things balanced.
That makes sense. So it's not just randomly growing. If it does get bigger then, are there sort of main mechanisms for how that happens?
Yes, broadly speaking, there are really two main ways.
Okay.
One is like the liver's internal plumbing system getting a bit backed up. We call it sinusoidal capacitance.
Sinusoidal capacitance.
So
Okay.
it basically just means the liver is holding more blood than usual within its tiny blood vessels, the sinusoids.
Like tiny sponges soaking up extra blood.
Kinda, yeah.
Yeah.
The other main way is through the liver tissue itself actually accumulating more. Well, more stuff.
Stuff like what?
This could be extra cells, like inflammatory cells or even tumor cells, or it could be different kinds of substances like fat or glycogen or other storage products building up inside the actual liver cells.
Okay, so either holding extra blood or accumulating extra stuff internally. Got it. Now, the sources mention different types of this enlargement, diffuse versus nodular. What's the key difference there?
Ah, yes. That's a really crucial distinction. It's about the pattern of the enlargement.
Right.
So diffuse or generalized hepatomegaly means the entire liver is enlarged pretty evenly. Like imagine the whole balloon inflating uniformly.
Okay, the whole organ swells up.
Exactly. And this often happens when there's inflammation spread throughout the liver, hepatitis.
Hepatitis, yeah.
And that inflammation can have various triggers. Could be the pet's own immune system acting up immune-mediated. Could be an infection. Or sometimes it's a more intense, specific type of inflammatory response called pyogranulomatous hepatitis.
Pyogranulomatous.
Yeah, it's a mouthful. But we basically categorize these based on the types of inflammatory cells we actually find in the liver tissue.
So like different kinds of immune system soldiers showing up tells you something about the battle.
Precisely. Yeah. It gives us clues. Then there's something called lymphoreticular hyperplasia.
Okay.
Think of this as an overgrowth of specific immune cells in the liver. It's often a sign the body's immune system is really kicked into high gear.
Why would it do that?
Well, maybe it's fighting off a persistent infection, or maybe it's dealing with a really high rate of red blood cell destruction somewhere else in the body. Liver congestion is another cause of diffuse swelling. That's when the blood flow out of the liver is hindered somehow.
Like a traffic jam for blood leaving the liver.
Exactly. Imagine a dam in a river just causing the water level to rise behind it. Same idea.
That's a clear picture. What about the stuff building up inside that you mentioned, the internal accumulation?
Right, that falls under the umbrella infiltration.
Infiltration, okay.
This could be due to cancer cells invading the liver tissue, either starting in the liver, like primary liver cancer, or spreading there from somewhere else, metastatic disease.
Okay, cancer is one type of infiltration.
Yes. But it could also be the buildup of other substances, like glycogen, which is a form of stored sugar. We see that sometimes with certain hormone imbalances, like Cushing's disease or lipids fats. That's a big one in cats with a condition called hepatic lipidosis or fatty liver disease.
Right, I've heard of that in cats.
Yeah, it's quite common, especially in overweight cats that stop eating. Sometimes it's the buildup of an abnormal protein called amyloid.
Amyloid.
And much more rarely, it could be certain metabolic byproducts accumulating because of a genetic issue, a metabolic storage disease.
Okay.
We also have to consider cysts within the liver, just fluid-filled sacs, and cholestasis.
Cholestasis.
That's where the flow of bile gets blocked. It can be blocked in the large tubes outside the liver, the extrahepatic bile ducts, or the blockage can be within the liver itself, causing the smaller bile ducts inside to swell up.
So bile backup.
Essentially, yes. And lastly, for diffuse enlargement, there's something called extramedullary hematopoiesis, EMH for short.
Extramedullary.
Hematopoiesis. It just means blood cell production happening outside the bone marrow.
Oh, so the liver starts making blood cells.
Exactly. When the body really needs them, the liver can sometimes step in.
Yeah.
And that process can make the whole organ larger.
Wow. Okay, that is a huge range of possibilities just for the whole liver getting bigger. What about when it's nodular or focal? That sounds more like specific lumps or bumps.
You're right. Nodular focal or asymmetric hepatomegaly suggests the enlargement isn't uniform across the whole organ.
Uneven swelling.
Yeah. You might actually feel distinct bumps. Or imaging like an ultrasound might show that only certain areas or lobes of the liver are enlarged.
What causes that pattern?
Well, tumors or neoplasia are definitely a primary concern here. Lumps can certainly be cancer,
Okay.
but it could also be a localized bleed within the liver tissue, a hematoma, or a pocket of infection or inflammation like an abscess.
So not always cancer then?
No, definitely not.
Yeah.
There's also something called hepatic nodular hyperplasia.
Hyperplasia. More cells.
Exactly. It's generally considered a benign, age-related change where you get these nodules of liver cells forming. Quite common in older dogs, actually.
Benign, that's good.
Often, yes. The liver can also develop nodules as it tries to repair itself after some kind of damage. We call that nodular regeneration.
So like little scar tissue patches almost.
Kind of, yeah, but with functioning liver cells trying to regrow. We can also see focal enlargement with something called an arteriovenous malformation.
Arteriovenous.
Artery and vein.
Right, an abnormal connection between an artery and a vein within the liver. This often makes one lobe of the liver get much bigger, sometimes while other parts actually shrink or atrophy.
Weird.
It is. Asymmetric regeneration can also happen if, say, a large chunk of the liver is surgically removed or severely damaged. The remaining parts might grow unevenly to compensate.
Makes sense.
And just like with diffuse enlargement, cysts can also appear in a more localized nodular way.
Okay.
And a really interesting dramatic one is liver lobe torsion.
Torsion, like twisting. Exactly. A whole lobe of the liver twists on its blood supply. This cuts off the venous drainage, the blood flow out, and that lobe swells up really rapidly and painfully due to acute congestion. It's an emergency.
Ouch. Yeah, that sounds bad.
It is. And finally, sometimes you can have congenital malformations where a part of the liver just didn't develop properly from birth, leading to an asymmetric appearance.
Okay, so we've got the different ways the liver can enlarge, diffuse versus nodular, but what kind of knock-on effects can this have? I mean, a big liver can't just sit there quietly, can it? It must cause some trouble.
Absolutely. You're right. Think about space. An enlarged organ is going to take up more room in the abdomen.
Right.
So it can definitely press on or even shift other organs around, like the stomach or the intestines.
Could that affect digestion?
It potentially could, yes.
Yeah.
And in some cases, the enlargement, especially if it's due to congestion, can increase the blood pressure within the liver's vessels, the sinusoids.
And that leads to?
That increased pressure can cause fluid to leak out into the abdominal cavity. We call that ascites, or peritoneal effusion.
Fluid in the belly. Okay.
And if the liver gets really, really large, it can actually push forward on the diaphragm.
The breathing muscle.
Exactly. And that can potentially reduce the amount of space the lungs have to expand.
Making it harder to breathe.
Potentially, yes,
Yeah.
in severe cases. And just the stretching of the liver itself, the outer capsule that covers it, can cause discomfort or pain for the pet, although it might be quite vague.
Just a general achiness, maybe.
Could be, yeah. Just feeling vaguely uncomfortable in the abdomen.
That makes sense. So does this tend to happen more in dogs or cats? Or is it mostly an age thing?
Well, our sources indicate that both dogs and cats can certainly develop hepatomegaly. It's seen in both species.
Okay.
However, it does seem to be diagnosed more frequently in older animals.
Older pets are more prone. Good to know. Now, if someone's listening and maybe thinking, my pet's belly does seem a bit rounder, what are some things they might have noticed at home? Or what might their vet find during an exam that points towards an enlarged liver?
Yeah, good question. From your perspective as the owner, you might notice that abdominal distension, the belly looking more rounded or even tight.
Okay.
Sometimes owners might actually feel a firm area or mass when they're petting their animal, especially if the pet is thin.
Feeling a lump.
Possibly. Other signs can be really vague, though. Maybe a decreased appetite, maybe just seeming a bit lethargic, not quite themselves.
Subtle signs.
Very subtle sometimes. And it's really important to stress that the signs depend hugely on what the underlying cause is. And sometimes, especially early on, there might be no obvious signs at all.
So it's not always going to scream liver problem.
Not always, no.
Yeah.
During a physical exam, the veterinarian might be able to feel the edge of the liver extending beyond the costal arch, the edge of the rib cage.
Feeling for the edge.
Right. Now, it's important to know that in some dogs, particularly deep-chested breeds, it's actually normal to feel a small part of the liver tip.
So breed matters.
It can, yes. In cats, it's generally considered more significant if the liver is palpable, if you can feel it, more than about 1.5 centimeters beyond the ribs.
Okay. Different benchmarks for dogs and cats.
Exactly. And another really important point in overweight or obese animals, feeling an enlarged liver can be much, much harder or even impossible just because of the extra fat.
Yeah, the padding gets in the way. Okay, so feeling it isn't always clear-cut. This really brings us to the big question. What are the actual causes? We've talked categories, but let's dive into some specifics. What things can actually trigger this?
Okay, yeah, this is where the list gets quite long, as there are so many possibilities. If we think about inflammation first.
Inflammation, okay.
We can have infectious hepatitis caused by bacteria, viruses, fungi, or chronic hepatitis, which is longer-term inflammation. Often in its early stages, it can cause enlargement. Then there's acute toxic hepatopathy.
Toxic, like poisoning.
Exactly. A huge variety of toxins can damage the liver quickly and cause swelling. Think certain plants, medications, chemicals, lots of things.
Scary.
It can be. In cats specifically, there's feline chronic cholangiohepatitis syndrome, CCHS, that involves inflammation of the bile ducts and liver. And of course, extrahepatic bile duct obstruction, EHBDO.
The blockage outside the liver.
Right. If bile can't get out, it backs up, causing inflammation and swelling. And finally, under inflammation, we have those lymphoreticular and pyogranulomatous causes.
Right, the immune system ones.
Yeah, things driven by the immune system, like immune-mediated hemolytic anemia, where the body attacks its own red cells, or lupus. Sometimes infections trigger this type of response, and sometimes, honestly, we don't find a specific cause. We call it idiopathic.
Okay, lots of inflammatory pathways. What about the blood flow issues, the congestion?
Right, venous outflow obstruction. One cause is sinusoidal occlusion syndrome, sometimes linked to certain toxins, including some herbal remedies or plants containing pyrrolizidine alkaloids.
Plant toxins again.
Yep. Then there's congestive hepatopathy, which is usually secondary to increased pressure in the big veins leading to the heart, the central veins.
So heart problems are a major player here.
A huge player. Things like right-sided congestive heart failure, problems with the tricuspid valve between the heart chambers, different types of heart muscle disease, or cardiomyopathy.
Okay.
Even congenital heart defects the pet was born with, like something called core triatriatum dexter, tumors in or around the heart, pericardial disease, inflammation, or fluid around the heart sac.
Wow.
Heartworm disease, pulmonary hypertension, high blood pressure in the lungs, and even severe heart rhythm problems, arrhythmias. All these can increase back pressure on the liver.
It really shows how connected the heart and liver are.
Absolutely. We also need to think about direct blockages of the major veins draining the liver, the hepatic veins or the vena cava.
What could block those big veins?
Blood clots or thrombosis, tumors growing into the veins or pressing on them from outside. In severe heartworm cases, the worms themselves can physically block the vena cava. That's vena cava syndrome.
Worms blocking a major vein.
Yeah.
Gosh.
Less commonly, you might see a narrowing or stenosis of the vena cava, or even a diaphragmatic hernia where abdominal organs shift and compress the vein. And there's Budd-Chiari syndrome, which involves clots in the smaller veins within the liver.
Oh, okay.
And as we mentioned, that acute liver lobe torsion, the twisting, causes sudden severe venous congestion in that lobe.
Right, the twisting emergency. Okay, so heart and vessel problems are big. What about infiltration things getting into the liver tissue?
Yeah, infiltration. Cancer is definitely a major cause here.
Primary or spread?
Both. Primary hepatic cancers start in the liver, things like lymphoma affecting the liver, hepatocellular carcinoma, which arises from liver cells, or cholangiocarcinoma from the bile duct cells.
Okay.
Or it could be metastatic disease, cancer that started somewhere else and spread to the liver. Common ones that do that include lymphosarcoma from elsewhere, hemangiosarcoma, which is a cancer of blood vessels. Many others can too.
So cancer's a big worry with infiltration. What else?
Metabolic abnormalities are another key category. We talked about amyloid, that abnormal protein, and fat accumulation, especially in feline hepatic lipidosis.
The fatty liver in cats, yeah.
Then there's glycogen buildup, often seen in canine glycogen-type vacuolar hepatopathy. This can be linked to excess steroids, either given as medication or from Cushing's disease, or sometimes with poorly controlled diabetes or high fat levels in the blood, hyperlipidemic syndrome.
Glycogen, stored sugar, right.
Exactly. And then there are those very rare genetic metabolic storage disorders where the body can't break down certain substances and they build up in the liver.
Okay.
And going back to the immune system, sometimes those lymphohistiocytic or pyogranulomatous inflammatory processes driven by infection or immune responses can look like infiltration too.
It gets complicated separating inflammation and infiltration sometimes.
It really can, yeah. They can overlap.
And we mentioned EMH before, the liver making blood cells. When does that kick in enough to enlarge the liver?
Right, extramedullary hematopoiesis. This happens when the body has a really high demand for new blood cells that the bone marrow can't keep up with.
Like in severe anemia.
Exactly. Various types of anemia can trigger it. Regenerative anemias, where the body is trying hard to make new red cells, could be due to immune-mediated destruction, oxidant injury from toxins, blood parasites like Babesia or mycoplasma, significant blood loss from trauma or internal bleeding, or cases where the bone marrow itself has failed. Sometimes it's idiopathic, we don't know the trigger. And interestingly, it can sometimes be seen alongside certain types of cancer too.
So the liver tries to pick up the slack from the bone marrow?
That's the idea, yes.
What about blockages specifically in the bile ducts? That sounds like it would cause major backup.
Oh, absolutely. Major bile duct obstruction is a significant cause. If the main tubes carrying bile from the liver and gallbladder to the intestine get blocked, things back up quickly.
What kinds of things can block those tubes?
Several things. Pancreatitis, inflammation of the pancreas, is a common one, as the bile duct runs through or very close to the pancreas.
Location matters.
Definitely. Cancer of the pancreas can also compress the duct. Tumors arising in that region where the ducts exit the liver, the porta hepatis, could be bile duct carcinoma itself or lymphoma.
Okay.
Sometimes inflammation or scarring, fibrosis, can narrow the common bile duct. There's also inspissated bile syndrome, where the bile becomes extremely thick and sludgy, forming a plug.
Thick bile, wow.
Yeah. Colodocal cysts are cysts specifically of the bile duct. Gallbladder mucocell, where the gallbladder fills with thick mucus, can sometimes obstruct outflow. Gallstones or cholestasis can get lodged in the duct.
Actual stones.
Yep. Even severe inflammation of the upper small intestine, proximal duodenitis, or a foreign object stuck in the duodenum can press on the opening where the bile duct enters.
A foreign body causing liver issues indirectly.
Indirectly, yes. And in cats, migration of liver flukes, parasitic flatworms, can physically block the bile ducts.
Flukes. That's wild. Okay, and what about those cysts we mentioned earlier? Can they be a primary cause?
They can. You can have primary single cysts or multiple biliary cysts present from birth. Sometimes cysts can actually arise from tumors.
Okay.
There are also ductal plate malformations and polycystic diseases where many cysts form in the liver. This is sometimes seen alongside kidney cysts, especially in Persian cats. There seems to be a genetic link there.
Persian cats, noted.
In cats, there's also a generally benign cystic tumor called a biliary cystadenoma. And of course, hepatic abscesses, pockets of infection filled with pus, are essentially cystic lesions too.
Abscesses in the liver. Okay. And finally, the sources listed a few sort of miscellaneous other causes.
Yes. A few more things to round it out. Certain drugs are known culprits. Corticosteroids, like prednisone, are strongly linked to that glycogen buildup, the vacuolar hepatopathy, especially in dogs.
Steroids, okay.
Phenobarbital, an anti-seizure medication commonly used in dogs, can also cause liver enlargement over time.
Phenobarbital, too.
Hepatic nodular hyperplasia, Those generally benign age-related nodules can contribute to overall size, though maybe not always causing massive enlargement on their own.
Right.
And in cats, a specific hormonal disorder called acromegaly, usually caused by a pituitary tumor producing excess growth hormone, can also lead to hepatomegaly.
Acromegaly in cats.
Okay.
Wow, that is a truly extensive list of potential reasons. It could feel pretty overwhelming, honestly.
It really could. It highlights how many different processes can affect the liver.
So thinking about all those causes, are there certain pets that are just inherently more likely to develop hepatomegaly? Are there clear risk factors?
There definitely seem to be some factors that increase the risk based on those underlying causes we just discussed.
Like what?
Well, pets with known heart disease or those with heartworm disease are clearly at higher risk because of the potential for congestion.
Makes sense.
If an animal has cancer anywhere in the body, there's a risk of it spreading to the liver, or primary liver cancer is always a possibility. So any neoplasia is a risk factor.
Okay, cancer is a big one.
Having any kind of pre-existing primary liver disease, whether it's inflammatory like chronic hepatitis, neoplastic, or involves cysts, naturally increases the likelihood of finding enlargement.
Right, if the liver is already struggling.
Exactly. The use of corticosteroid medications, whether given by the vet or produced in excess by the body itself in Cushing's disease, is a major risk factor, especially for that glycogen buildup in dogs.
Steroids again.
And treatment with phenobarbital, as we just mentioned. Poorly controlled diabetes mellitus is another risk factor, often linked to fatty changes or glycogen accumulation.
Diabetes, okay.
And that specific scenario in obese cats that suddenly stop eating that anorexia is a huge trigger for hepatic lipidosis, fatty liver, and therefore hepatomegaly.
The anorexic fat cat, yeah.
It's a classic risk.
Yeah.
And then anything causing that extrahepatic bile duct obstruction, the EHBDO we talked about. And finally, certain types of anemia that lead to that diffuse hepatic EMH, the liver making blood cells.
Okay, so that helps narrow it down a bit, knowing the risk factors. So if a vet suspects an enlarged liver, maybe they feel it or see it on an x-ray, how do they even begin to untangle that huge list of possibilities? What's the diagnostic process look like?
It's definitely a process of elimination and gathering clues. The first step is often confirming it is the liver and distinguishing it from other things that could cause a similar finding, like maybe the spleen is enlarged, or there's a mass somewhere else, or just fluid in the abdomen making things feel big.
Ruling out lookalikes.
Exactly. Imaging like ultrasound is key there. They'll also want to quickly assess if the primary issue seems to be cardiac, is there evidence of heart failure, or is the pet severely anemic, suggesting maybe EMH is playing a big role.
Prioritizing the big systems.
Right. And then looking for other clinical signs that might point towards liver dysfunction itself is really important. Things like lethargy, vomiting, diarrhea, increased thirst or urination, and especially jaundice, that yellowing of the skin, gums, or eyes.
Jaundice is a big liver sign, right?
It is. Usually indicates a problem with bilirubin processing or bile flow. And specific signs for conditions like vacuolar hepatopathy, maybe increased appetite, potbelly, or hepatic lipidosis in cats, severe anorexia, weight loss, jaundice, can also provide strong clues.
Okay, so history and physical exam give clues. Then I assume blood tests are pretty much essential.
Oh, absolutely. Basic blood work, a complete blood count, or CBC, a serum biochemistry profile, and a urinalysis that's usually the foundational step.
What can those tell you?
A lot, actually. The CBC looks at red cells, white cells, and platelets. It can tell us if there's anemia, and sometimes why. For instance, seeing spherocytes, which are specific types of red blood cells, might strongly suggest immune-mediated hemolytic anemia.
Clues in the cell shapes.
Exactly. The CBC also checks for abnormal white blood cells, like blast cells, which could indicate leukemia affecting the liver. And platelet counts can be affected by various liver-related issues, too.
Okay, and the biochemistry, that's the liver enzymes, right?
Yeah, that's a big part of it, yes. The biochemistry panel measures levels of various liver enzymes like ALT, AST, ALP, and GGT. It also measures bilirubin, proteins made by the liver like albumin, plus globulins, cholesterol, glucose, BUN, lots of things.
How do those help narrow it down?
Well, the pattern of enzyme elevations, along with changes in bilirubin, proteins, and other values, can really help categorize the problem. Is it predominantly inflammatory? Is it suggestive of cholestasis, that bile flow issue? Is it more infiltrative, maybe cancer? Or does it look like dysfunction, the liver not doing its jobs properly?
Patterns are key.
Very key. For example, a markedly high ALP, often way out of proportion to other enzymes, is really characteristic of that glycogen-type vacuolar hepatopathy in dogs, especially if linked to steroid use.
Ah, specific signature.
Kind of. And in cats with hepatic lipidosis, we typically see high ALP, AST, and ALT, often with high bilirubin, but GGT might be normal or only mildly increased, which is another helpful pattern.
Interesting. So the blood work is really strong hints. Are there other specialized lab tests?
Definitely. Depending on those initial results and the clinical picture, the vet might recommend other tests.
Like what?
In cats, testing for feline leukemia virus, FLL, and feline immunodeficiency virus, FIV, is often done. Looking closely at a blood smear, maybe doing a Buffy coat exam to look for certain infectious organisms or abnormal cells. Coagulation panels, checking PT, APTT, fibrinogen are crucial because the liver makes clotting factors, so its function affects bleeding risk.
Especially before procedures.
Absolutely critical before any biopsy. Bile acid testing, measuring total serum bile acids, or TSBA, is a specific test of liver function. Pituitary adrenal axis testing might be done if Cushing's disease is suspected. Heartworm testing, obviously. Serology for fungal diseases like coccidioids or histoplasma in areas where they exist, and other specific antibody or PCR tests for infectious diseases if suspected.
Wow, a whole battery of potential tests. What about actually looking at the liver with imaging?
Imaging is vital. Abdominal radiographs or X-rays are often a first step.
What do they show?
They can confirm hepatomegaly. You might see the liver shadow looking enlarged, maybe with rounded margins instead of sharp edges. You might also see it pushing the stomach or other organs out of their normal position.
Okay, confirm size and position.
Right. But X-rays have limitations. They don't tell you much about the internal structure of the liver. Thoracic radiographs, chest X-rays are also really important.
Why chest X-rays for a liver problem?
Mainly to check for metastasis, has cancer spread to the lungs. Also look at the heart size and shape and evaluate the diaphragm.
Got it. So for more detail on the liver itself.
Abdominal ultrasonography is the next step, and it's incredibly valuable.
Ultrasound, what does that add?
So much more detail. Ultrasound lets us assess the liver's size and shape much more accurately. Crucially, it shows us the internal characteristics, the echogenicity or texture of the liver tissue. Is it uniform? Are there nodules, cysts, masses?
Seeing inside.
Exactly. We can measure nodules, look at blood vessel flow to some extent using Doppler, and very importantly, evaluate the gallbladder and bile ducts for signs of obstruction, like dilation or stones or sludge. Ultrasound also lets us look closely at other abdominal organs, the spleen, pancreas, kidneys, lymph nodes.
Can it tell if a lump is cancer?
Not always definitively, unfortunately. Some cancerous nodules can look very similar to benign ones, like nodular hyperplasia, but the overall appearance, the number of lesions, involvement of other organs, it all adds to the picture. It guides the next steps.
Okay, so imaging gives us a great view, but sometimes you need an actual sample of the liver tissue itself, right, to know for sure.
That's often the case, yes, especially if imaging isn't definitive or if we need to know the specific type of inflammation or infiltration. That's where procedures like fine needle aspiration or FNA and liver biopsy come in.
FNA, that's with a needle.
Right. A fine needle is inserted into the liver, usually guided by ultrasound, to collect a small sample of cells. These are smeared onto a slide and examined.
What can FNA tell you?
It can sometimes be diagnostic. It might reveal infectious organisms, evidence of significant vacuolar change like fat or glycogen, or clearly identify certain types of cancer cells like lymphoma or metastatic carcinoma.
But not always.
Not always. Sometimes it just gets blood, or the sample isn't representative, or it can't distinguish between certain conditions like inflammation versus low-grade cancer or hyperplasia versus early cancer. It gives you cells, but not tissue architecture.
So biopsy is more informative?
Generally, yes. A liver biopsy takes a larger piece of tissue, preserving the architecture, how the cells are arranged relative to each other, the bile ducts, the blood vessels. This usually provides much more information.
When would you definitely do a biopsy?
It's usually indicated when non-invasive tests haven't reached a diagnosis, and you need more specific information to guide treatment, especially if considering potentially toxic therapies like chemotherapy. But you'd want to rule out major contraindications first, like severe clotting problems or suspected extrahepatic bile duct obstruction that might need surgery anyway.
How do you get a biopsy sample?
Several ways. It can be done percutaneously through the skin, again, usually guided by ultrasound using special biopsy needles. Or it can be done laparoscopically using a small camera and instruments inserted through tiny incisions. Or via traditional open abdominal surgery. Each has pros and cons regarding invasiveness and sample size.
And what happens to the tissue sample?
It's sent to a pathologist. They process it and examine it under a microscope using standard stains like hematoxylin and eosin, H&E, but they can also use special stains to highlight specific things.
Special stains, like what?
Things like reticulin stain to look at the liver's structural framework, Masson's trichrome to highlight fibrous tissue or scarring, rhodonine or copper stains to look for copper accumulation, PAS stain for glycogen, acid-fast stains for certain bacteria, Congo red for amyloid, or oil red O on frozen sections to specifically identify fat.
Lots of tools to analyze the tissue.
Definitely. And if an infection is suspected, part of the biopsy sample can also be sent for microbial culture, bacterial, fungal culture.
Right, to grow the bug. And you mentioned checking clotting first.
Absolutely essential before sticking needles or instruments into the liver, as it's very vascular and poor clotting could lead to serious bleeding. So checking PT, APTT, maybe even platelet function with a BMET test is crucial.
Makes sense. What about other fluids? If there's fluid in the abdomen?
Yes, if there's abdominal effusion or ascites, collecting a sample of that fluid for analysis is very helpful. Looking at the cells in it, cytology, measuring the protein content and potentially culturing it can give big clues about the underlying cause. Is it from high pressure, inflammation, infection, cancer?
Okay.
And similarly, if heart disease is suspected and there's pericardial effusion, fluid around the heart seen on echo, performing pericardiocentesis, draining that fluid can be both diagnostic and therapeutic.
Phew. It really sounds like a very thorough, step-by-step puzzle-solving process to get to the bottom of why a pet's liver might be enlarged.
It absolutely is. But that systematic, detailed investigation is so critical for reaching an accurate diagnosis, which then allows for the most appropriate treatment plan.
So just to kind of wrap things up here, we've learned that hepatomegaly, while it might sound a bit intimidating as a term,
Yeah, it does sound technical.
it simply means an enlarged liver. And crucially, it's a sign that points towards a really, really wide range of potential underlying issues. Everything from different kinds of inflammation, problems with blood flow causing congestion, to infiltration of abnormal cells or substances, and even blockages in the plumbing, so to speak.
Exactly.
Yeah.
And hopefully understanding these different possibilities, these categories, and the steps your vet might take to investigate the blood work, the imaging, potentially biopsies, helps you, the listener, be a more informed and engaged partner in your pet's healthcare.
Yeah, maybe some of those connections we talked about, like heart disease affecting the liver or medications causing changes, maybe those were sort of aha moments, helping connect the dots if your vet is recommending certain tests.
That's the goal, to understand the why behind the diagnostic process.
And while that huge list of potential causes we went through might seem a bit daunting or even scary,
It can be, yeah.
the key takeaway is that a thorough, systematic workup by your veterinarian is absolutely essential to narrow down those possibilities, figure out what's actually going on with your individual pet, and then most importantly, get them started on the right track for treatment and care.
Well said. And maybe just one final thought to leave you with.
Yeah.
Considering just how many absolutely crucial jobs the liver performs in the body, processing nutrients, filtering toxins, making vital proteins, managing blood sugar, helping with digestion, on and on.
It's a powerhouse organ.
It really is.
Yeah.
So what does it tell us about how incredibly interconnected all the body's systems truly are? When a problem in potentially some other system or even a systemic issue manifests as something as seemingly straightforward as just an enlarged organ.
That's interesting.
It makes you wonder, doesn't it? How sometimes seemingly unrelated symptoms or problems might actually be linked back to this central vital organ working overtime, or maybe not quite functioning the way it should, something to ponder.